I'll quickly try to move to the next type of osteomyelitis, which we'll be discussing. Okay, so this is the pyogenic osteomyelitis. Anytime you hear anything pyogenic, you are basically talking about that thing has the ability of what? Releasing pus. Okay, so that means there's osteomyelitis as like a bone infection, and this bone infection has developed pus. So when you're talking about these two things, two factors are here. It could be the type of bacteria infecting this bone is the one that's actually triggering for what? Pus formation. Or it could be that this infection has been there for a very long time. That's why you're actually having what? Collection of pus. So you should know this is the imaging, and everything you see around here is pus. Okay, the main bone is there and the bone is getting infected. That's why the color here is so bright. You get? So that's what it. So it's a serious bacterial infection and of the bone, and it causes a lot of pain, a lot of swelling, a lot of fever, and it could lead to what? Chronic disability. So issues have gone there for a very long time. You are not using that part of the body like you used to use. Okay, so it's caused by mainly is bacteria, and the bacterial infection has actually led to inflammation. The tissues are dying, that's necrosis, and there's destruction of bone tissue. So mostly it's caused by Staphylococcus aureus, Streptococcus, and also the Enterobacter CK and the Pseudomonas. Okay, so routes of infection, the infection could get there through blood. The infection could get there through direct inoculation. The infection could get there through what? Contiguous spread. Okay, so symptoms: the bone is painful, swelling, redness, and warmth over the affected area, fever, chills, fatigue, irritability, limited mobility of the affected limb. So diagnosis is clinical examination. We are looking out for all those physical examination things, and also you do blood tests to see if all those inflammatory markers are actually elevated. So imagings, you can use X-rays, MRI, CT scans, radionuclide bone scans, bone biopsies, all of those things. Okay, that's why I'll have an X-ray here to diagnose. That's you are confirming that the condition exists. Okay, so this pyogenic osteomyelitis. So treatment, that is usually caused by bacteria, and it's a serious infection. So I won't start giving someone drug through the mouth. I'll go through the veins directly. So intravenous antibiotics. Surgically you debride, you drench the abscess. Okay, then stabilize the bone if needed. So of course the patient have to rest. You can't be using that part of the body like you used to use other ones before. Then also pain management. So that's what we got.